What is Botox, filler, threads?
And everybody counts any aesthetic procedure as being a Botox has been done.
Can we do all these three procedures together in a patient, or what?
We all know that a combination treatment works wonderful.
Good morning. Welcome to this podcast. We have Dr. Syed with us. Good morning, sir.
Good morning.
Welcome to the podcast also.
Thank you. Nice to have me.
So we just wanted to know more about what is Botox, filler, threads. Everyone is raving about all these things, and most of the people don't know the difference between all three of them. We just need to get a clearer picture of what is Botox, what is threads, what is filler, and which candidates are better for that.
Okay. First and foremost, I'm very grateful to all of you for having me in your podcast. Yes, this is quite common. Many a times people don't understand what is Botox and what is filler and threads, and everybody counts any aesthetic procedure as being a Botox has been done. I see Botox is a substance that relaxes our muscles, and it's primarily meant for dynamic lines which come on our face. How it has got many other indications in dermatology as well as in medicine for other departments. So it is primarily relaxes our muscles and gets rid of the lines and all. The filler is meant to give the contour. Where all you have the volume deficit, for example, around our below our eyes called a teardrop. Sometimes people don't have adequate volume around their cheeks. So we use fillers to contour and to contour the faces which has got that aging and problem and all. And sometimes we enhance certain features, like sometimes we want to give the pout on the lips. We need to enhance somebody's cheeks and all. So there we use the filler. So filler is primarily nowadays made of hyaluronic acid, which is safe. Now coming to the threads. The threads are different substances. We call them suspendable devices. They are used to reposition the facial fat back. Somebody who has got a sagging, like for example a jowls, or somebody who has got too much of lock lines and want to get a facelift. You can call it a non-surgical facelift. So it's being done with the help of the threads. So if I conclude it, Botox is to relax and get rid of your lines. Filler is to contour, give you volume on your face, and thread is to reposition and give you lift on your face.
Okay, that was a perfect explanation.
Yeah, thank you.
Yeah. So, can we do all these three procedures together in a patient, or what is combination treatment if we can incorporate Botox and fillers together in a patient? I just want to know that.
Well, it's a very good question, because many a times people do come and they just ask us, Doc, I just want to get a Botox. But for as a physician, or for dermatologist, plastic surgeon, whosoever is practicing aesthetic dermatology, we all know that a combination treatment works wonderful, especially on people who are aging. Above 40 years, above 50 years. They are just a Botox or just a filler or a thread does not give you that wow result. So it's an art. Like for example, you want to make a painting. If you have different colors, different brushes, and then you can give a wonderful, make a wonderful painting. Just like that, I always tell my patients, let me have a little bit of Botox, little bit of fillers, and little bit of threads. Well, yes, a combination is always good. However, it varies from patient to patient.
Okay. So that harmonious.
Yes, it gives quite more harmoniously, because everybody will not have just every patient who is above 40 years of age will have a little bit of forehead lines, maybe lines around the eyes, some sort of or some degree of sagging will be there, that will be taken care with the threads, or somewhere you will have volume deficit, that will be taken care with the fillers. So if we use three things together, gives wonderful results.
So it's almost like a better version of yourselves.
Exactly. Gives you a more youthful look and gives a more harmonious, balanced and proportionate faces if you use these things in combination.
And the added part is that there is zero cuts and zero downtime.
Absolutely. It's not a surgery, it's non-surgical procedures, and there's hardly half an hour of downtime, and people now come to clinics and get it done, and they leave and they just back to their work.
That's great.